So good afternoon, everyone. I'm Hao Huang, assistant professor of social sciences. Welcome to the Illinois Tech Social Sciences Great Problems, Great Minds Seminar Series. Before I introduce today's speaker, I would like you to know you can submit questions during the webinar by typing in the chat box. We will open the floor to questions at the end of the webinar. Now I will introduce today's speaker, Dr. Xiaobai Engineer Yao. Dr. Xiaobai Engineer Yao is a professor of geography at the University of Georgia. Dr. Yao's research interests focus on geospatial data science, network analysis, and particularly the applications of geospatial techniques to study human dynamics and public health problems. She has published research articles extensively in top journals such as Computers, Environment, and Urban Systems, Urban Forestry, and Urban Greening and Transaction in GIS. She is currently present in editor of the Cartography and Geographic Information Society and a board member of the University Consortium for Geographic Information Science. She also chairs the International Cartographic Association's Commission on Geospatial Analysis and Modeling. She received her PhD in geography from the State University of New York at Buffalo, master's degree from the Tudor University, and bachelor degree from Wuhan University. It's glad to welcome Dr. Xiaobai Engineer Yao.
Thank you, Dr. Huang. It's a great pleasure to be with you and share this interesting work. Well, we have been interested in it and just presented this piece of work recently. So I'm excited to have this opportunity to discuss this with you again. It's about modeling the transmissibility of COVID, and we are looking at it from a geospatial perspective. So why do we want to look at this issue from a specific geospatial perspective? Well, just look at the background, or just briefly putting our study in a general background of all kinds of geographic approaches to studying COVID-19. And then I will talk briefly about the theoretical background framework we are relying on since the beginning of this, the motivation of our work. And then I will go to some specifics. I will probably skip a little bit technical details, or just look at the big picture and then quickly go to the findings. So that's the plan. Well, the background, you can see I just captured the transmissibility rate, the new cases in Illinois for the past year. So you can see in the past, it's different everywhere, right? Well, COVID-19 has spread so rapidly in the world in the past 3 years. I recently had a business trip, a conference trip somewhere, and one of our colleagues went with me. Well, we just interacted a little bit, and then the next day she was sick, and she was tested and it was COVID positive. The following day, she said, well, she felt a lot better. Just the fever lasted for 1 day. So now people are taking it more easily, because what you see, there is a really rapid change in the past 3 years. Now, the new cases might be significantly lower every day. We have observed different rates in different parts of the world. So that's why last year I went to another trip in Italy. So before leaving, I was so nervous. This year I felt a lot better now because of the change, right? The transmissibility and the overall cases and treatment, the symptoms, everything changed so rapidly. Last year I was a little bit more nervous. So on the left side, you can see the same screen capture from the same website about Italy. You can see a lot higher numbers at that time. So the key thing we have been thinking that really inspired our work is that space and time matter. every year, even every month, the rate changes. It's different. And in different parts of the world, the curve also changes differently. It peaks at a different time. Well, every place has a peak, but maybe the peak at different times. So that's kind of the background that it motivate us to investigate a little bit more. In general, what have geographers been doing trying to help combat COVID? There are a lot of work at the very beginning. If we remember, if you recall, at the very beginning, we talked about contact tracing and GIS, GPS, even our cell phones, there are apps that help to do contact tracing. Other people have been doing spatial temporal analysis and modeling and study the changes of cases, well, not rate, but cases. There are all kinds of geovisualization, visual analytics. Everyone is probably very familiar with the dashboard, the very beginning from Johns Hopkins, but then there's really an explosion of all kinds of visualization platforms that's really helpful. And of course, we have also been thinking about how human behavior, human dynamics affect the change, the transmissibility rate, which I will touch base in just a little bit in a few later, a few more slides. And there are studies about health disparity in terms of people's accessibility to care. At the beginning, even to vaccine, and then accessibility to healthcare. So we can see the health disparity in COVID as well. So generally, geographers have been a lot from all kinds of perspectives. Specifically for our research, we have been thinking about it. We started about probably 2 years ago, this research, we started about 2 years ago. We are concerned about the changing nature. The first slide, I showed you different places, picked at different time, you see different curves. So we're trying to compare not from place to place, but also time to time. And we observed, we realized the rate of transmissibility of COVID-19 cannot be simply captured or represented as one number, R0. Very often it's R0, right? It's reported in the news, in the social media, and R0 is basic reproduction number. So at the very beginning, we received that it's about around 2. R0 represents the average number of people that an infected person might pass on to. So on average, if it's 2, or on average, a sick, infected person might pass this along to other people. But is that single number true the whole period in the past 3 years? Of course not. We see different transmissibility rate. So R0 as a single number, it may not be a very good measure for the transmissibility, because we have already observed the differences, the different changing rate, transmissibility rate. In the literature, there's another concept being proposed called effective reproduction number. So people have been, in the literature, has been proposed, have been considered, but unfortunately, this has not been measured to specific areas or a very specific time. Generally, it's for a general time, or maybe for a country or for a general area. So it's more like the concept is there, but we do need to measure it, put it in action and measure it for our own local place. So what we have, our motivation is to do something to measure spatially and temporally localized effective reproduction number. So that's the whole idea, kind of started at the very beginning. That's the whole idea that keeps us moving. So we have, in this general research, we have 3 objectives or research questions to answer. First of all, how do we measure it? The actual, the real one, not the R0, not the beginning, the single number, but in fact, it's more localized actual measure of transmissibility. How do we have a localized measure for it, spatially and temporally? The second research question is, if we can do that, we can measure the real transmissibility rate local at real, not real time, but on a daily basis, for example. Then longitudinally, time series or specific place over time, we can see the change, right? We observing all those changes and we try to understand whether or not the local contact behavior or local policy context or human behavior responses in this local area respond to or affect the changing rate of transmissibility. It's changing, but why? Does it have something to do with what we do, how we do, and have anything to do with the policy that was adopted locally? So that's the second question. The third question is comparing the local place with its neighbors across the geographic area. So from a cross-sectional, meaning at the same time, how do we compare with others, with our neighbors? At a specific time, how is the spatial variability of the transmissibility rate associated with the local context variables, not the behavior, but kind of more static perspective, the demographic composition, social economic status, environmental and health behavior characteristics of kind of the overall geographic context of these places. So that's kind of the three questions we try to answer. So just want to share with you, most of it have already been done and submitted for publication. It's we're doing the final minor revision for it. But let's start from the very beginning. Where did we start? We started from the epidemiological model of either SIR or SEIR, which means if someone were caught by this virus, get infected, here, the top portion of this, the person probably does not show any symptom right away. He or she is infected, but there's nothing. There is a latent period, and the person probably doesn't feel anything special, and the person is not contagious at all, not infectious at all. So that's the latent period. That's from an epidemiological perspective. And then after that, the person becomes infectious for a number of days, for a period of time. Specifically for COVID, of course, we are not making this up. We adopted the number, the popular number in the literature. So I think the latent period is roughly 3 days on average. Infectious period is 7 days for COVID-19. Of course, it's different for different virus, and that's what we did. We adopted from the literature. So that's kind of the foundation. We use that as parameters in the study. Again, continue with that theoretical framework in epidemiology. They think the infectious disease can pass along to other people, and the rate of transmissibility here, the RE, the real rate of transmissibility is related to 3 factors. First of all is the contact rate. How often do we contact with other people who may potentially, possibly have infectious, right? So the contact rate is number one thing. The second is infectiousness, which means the likelihood of transmission, the likelihood of getting infected in one single contact. So it's the probability of getting infected. And the third is the infectious period, which we already mentioned previously in the previous slide. So with regard to the infectious period, it's really totally about the virus itself. So there's nothing we can do about it. So that's why I'm using a different color in the blue box. The other two, however, is something that can be related or impacted, affected by human policy or behavior context. So that's the whole picture. Our mobility pattern, do we go out? At the very beginning of pandemic, have we reduced our activity? outdoor activity. We did, right? We don't really go to work. People don't even need to go to work in person. We can do remote virtual Zoom meetings and so forth. So by doing that, we reduce the human mobility, and doing that, it affects the contact rate, right? We're doing things virtually. So that's some behavior, changing human behavior pattern that can affect the contact rate. The other thing is a risk perception or government policy, for example, whether or not we wear masks, whether or not we try or we want to be vaccinated. All those behavior will affect the infectiousness, right? If we wear masks, we can reduce the infectiousness with one single contact. Same thing with vaccination. Of course, so those are the things we try to understand. If we can understand intuitively, they should be associated, but now we want to also investigate whether or not it's true. Infectious period, it has nothing to do with our research. We're just using it as a number that's provided from the literature. Okay, so that's kind of the theoretical background. Now continue on this, we try to, first of all, we want to establish an algorithm to calculate the real-time, I shouldn't say real-time, keep saying real-time, but it's really, it's a localized, effective reproduction number to measure transmissibility. And then secondly, we want to consider those context factors about human mobility patterns, policy requirements, for example, the face covering, gathering restriction, and so forth, the health perception, risk perception related to the health perception and awareness, washing hands, and so forth, vaccine rate. So all those context factors will be used and we try to understand the relationship. Okay, well, I probably talked about this already previously. So this is kind of the picture showing the flow of influence on the three things. The effective contact rate, the infectiousness can be affected by the mobility behavior, by safety behavior. Infectious period is something that's not going to be affected by this, of course. Okay, so I'll continue. In our research design, first of all, we try to develop a RE, that's effective transmissibility rate, effective reproduction number, that's to measure the transmissibility rate. We try to develop this algorithm, and then based on the daily new case statistics gathered from a Harvard website, we collected data for the US starting from March 2020 all the way to October, but we saved the last month for testing for evaluation of accuracy. So we used all those data and based on the algorithm that was developed to construct a database, a space-time database of daily RE, as effective reproduction number for each county on each day. Okay, the second research question is focusing on a specific county, for example, your county or your specific county. I don't know whether or not you have all the data, but if it's data, we realized most of the counties, we do have data, but not all of them. So for each county, fix that county, and then we want to look at time series and longitudinal view and try to perform time series analysis to check in the association, the relationship between those context variables and behavior, human mobility variables, and the changing transmissibility rate. So that's the second research question. Based on the database that's constructed, we use place-specific analysis. We use several machine learning models to try to investigate the relationship between those context variables and the effective reproduction number. So the final model, of course, will be place-specific. We used 4 different models and try to choose the best performer. And then using the model here at the end of this step, using this model, we saved 1 month of data, that's October data. we use that number, that month's data to evaluate the accuracy. So basically from the machine learning model, use that model to predict future cases. That's for October 2021. The predicted cases will be evaluated, compared against the real number, real reported case. And that helps us to have accuracy evaluation. So that's the second question. The third one, we didn't pay too much attention because that's for future work. But so far we spent, it's not that we didn't pay too much attention. We did kind of preliminary work because that's a direction we'll further explore. So in the preliminary work for the third research question, what we did is to apply a geographically weighted regression model. Just when we fix the time, just horizontally cross-sectional, comparing all counties in the United States, and we try to establish a GWR model to investigate the relationship between the transmissibility rate and other local demographic, social, economic, and other variables, geographic context variables. Okay, so let me look at, that's the whole research design, but let me report our results for each of those research questions. So for the first research question, we try to establish a model. Starting from the reported cases, I'm not going to go to kind of detailed technical detail, but just the workflow, the general, the big picture of the thinking process. From the reported cases, we can calculate the new cases, new cases every day on a daily basis. And then we did a 7-day average. And then from there, we can calculate the growth rate of the cases, the changing rate of cases. And that can help us to get the transmissibility rate. Okay, so the final one, remember previously we talked about the epidemiological model. There could be different models. We used the two. We established a model for each one of them. SIR model, and both of them are classical model, and the other is a SEIR model. They are very similar to a great extent, but still some differences there. So we used both of them. The final calculation result is not fundamentally different or anything. So the model has been developed for both of them, but later in the case study, we used this model, the SEIR model. This equation was used to calculate the real effective reproduction number. All right. So here you can see for both of them, we have two parameters that we need. Well, these are kind of fixed. Those are the things that I mentioned a little bit earlier related to the infectiousness. Those are the numbers we use as parameter as given from the literature. For example, gamma is the transition rate from latent to infectious. So the inverse of it is the average infection period. That's 7 days. The inverse of alpha, the transition rate from infectious to removed. Well, no, that's also given actually. We adopted from the literature. So you can see here, it's just the growth rate, the lambda that's calculated in the previous step will be used, that will help us to get the real effective reproduction number. So here is the result. Based on that model, we calculated the RE for each county, because we have more than a year, maybe 1.5 years of data. So for every single time, every single county, we calculated them. This is the beginning, kind of the first data we have, first day data we have. And this is the calculation result. There are only some counties have data, and you see the transmissibility rate is pretty high. Some are 3, and the others here, this area, Washington State, it's close to 2 to 3, right? So that's March 13, 2020, at the very beginning. But later on, you can find it's spread out a lot significantly. However, the transmissibility rate decreased significantly. A lot of blue number. The blue color indicates as a very low transmissibility. It's 0 to 1. And then the yellow ones is somewhere between 1 and 2. Remember, that's the average number of persons, one person can pass on to, right? And then the orange is 2 to 3. Anything larger than 2 is not really a very good sign, but fortunately here we do not see a lot of them. And this is very high, that's the red color. Okay, so this is May, and then September, I'll go quickly, and then December 1st. So it's kind of spread out more and more, but the rate is actually decreasing for a lot of areas, not every single area, but for both of them, you can see the red color, which means it's very the transmissibility, very high transmissibility rate. Okay, yeah, until October 31st. Okay. That's the last one, but we have daily data. I'm just picking a few days to share with you. There is also a dashboard to show different variables. And I'm just share. This is developed by Xiaobai, but that's not the focus. I just want to share this quickly with you to visually examine the changing pattern. All right, so by now we have just answered the first question. How do we measure it? It's basic, some calculation which helps us to produce the space-time data set of RE. Now, the second question is to investigate the temporal changes of any single place. Here in our case study, each place is a county because we use the county level data. Of course, it really depends on the geographic area that you choose, the spatial scale you choose. In this case study, it's county. So the purpose of this research question is to investigate the policy and human behavioral context variables and their association with the change in transmissibility rate, right? So the data we have the daily cases data from Harvard and Dataverse website, population data is a census data, pandemic intervention policy is from this, the Kaiser Family Foundation website. Mobility data is from Google Mobility Report. So all those data plus a few other standard data that's kind of common from Census Tract and from Census Bureau. And then we applied 4 different machine learning methods to trying to establish the relationship. Okay, 4 of them. So let me report the results of this model, of 4 models. We run this model for each county, right? But we randomly choose 6 counties just because there is a model for each county. They're separate. I just randomly choose 5 counties, 6 counties here. There are 6 counties just for comparison, for visualization, to share this with you. But in fact, we have it for every single county. You can see here, different color refers to different model. This is XGBoost and random forest. The orange one is random forest. This gray is neural network. We even have linear regression, which I didn't even mention previously, right? I don't think it's really necessary. So kind of we dropped it pretty early. And then this is the exponential regression. Yeah, linear regression, we used it at the beginning just as a baseline thing to compare with. We didn't really expect this to be good. So here's the RE value. We want high R square, not RE, I'm sorry, R square values. Of course, for a model to be useful, to be helpful, we usually expect higher R square. So here, the highest one, you can see the winner probably are the 2 ensemble models, the random forest and XGBoost. They are both good, but random forest is better, right, for almost all cases. However, we did see a runner-up. This exponential regression is pretty close as well. But let's go to the accuracy consideration. On the right side, this is the root mean squared error value, which we expect lower values for good models. The lowest one, we can see random forest is really a very good performer. Probably the best performer here, lower than all the others almost across the board, except this one. But exponential model is also pretty close. The reason I pick exponential model here when I share this with you is that clearly the winner, the overall winner is random forest. If we do this for prediction or for any other estimation, we probably are going to adopt random forest. However, exponential regression has the advantage of interpretability. It's easy. You can see the coefficients, you can map them out so that you can tell, you can share stories, and it gives us more information. So I also want to keep this one as well. So in the next step, we actually choose both. Random forest, best performer, but this is the best kind of balance, best performer. The exponential regression is the best model in terms of balance. So we choose both of them in the next step. So here for the prediction and evaluation, we only choose two for comparison. I think this one, the one that I'm showing you, is the exponential model, regression model. Remember, we reserved the last month of data and tried to compare, to use it as ground truth and compare with the prediction. Here, the orange curve shows the predicted values for every day. And the vertical bars, the blue color, indicates the daily report, the real reported cases. So you can see for all the 6 cities that the counties that we choose to share with you, you can see they are pretty consistent. They are, well, there is no particular reason we choose this 6, 7. They're probably in close to major metropolitan areas, but others are the model worked for all counties as well. I will show you later some results for all counties. Okay, so that's the evaluation. That's the second research question, which is about the relationship. Now, I want to share some more kind of stories. Those are the results. We have the evaluation of accuracy and everything for a random forest, and later I'm going to show you the feature importance. That's probably the only thing I can share with you, just to show the overall the feature importance. But for exponential model, there's a lot I can map out for you, because there's a coefficient associated with each variable, which allow us to map it out. So for each of the variables, we have created map to visualize the spatial distribution of the coefficient. For example, on the left side is the face covering, which means the face cover here, the delta variant. So those are all percentages. So for example, the delta variant is the percentage of cases, confirmed cases, that's delta variant. So for delta variant, it's positive association. If you see higher percentage of delta variant, you expect to see higher transmissibility rate, which is kind of intuitively consistent. On the left side, space covering, and you see we see both direction, right? Blue color is negative, and more orange pink color means positive relationship. This is kind of interesting. We have been thinking about this, how this can be explained, but then we realize there is a lag effect here, and there's a perception thing. If the transmissibility rate is really high in an area, then people realize, oh, well, we need to wear mask. Nowadays, I don't wear mask anymore because I don't really see the kind of the danger, the risk. But last year or several months ago, I always wear a face mask whenever I go out. I think it's a perception thing. When the rate is high, people are more likely to, well, at least start to, and so the face covering rate percentage will be really high. On the other hand, so this is kind of, when this is high, that is high. But on the other hand, when it's high, it helps to reduce the transmissibility rate, right? So there are both mechanisms at work, kind of the positive relationship and negative relationship, both at work. So that's kind of our interpretation of the results. Here is I have a few maps to show the coefficients of the changes in mobility. Because at the beginning we talked about if people, the the chance of contact. When people go out more, interact more outside, then there's a higher chance to have contact with others, contact rates, right? So here the changes, Google Mobility Report give us the mobility change in different categories. So we tested all those categories. So in grocery shopping, the mobility for with the destination as for grocery shopping or pharmacies, the change in that rate shows a positive relationship, or overall the changes shows positive relationship. The more likely, what positive means, this is a change. If you start to increase mobility, then the rate becomes higher. So it's kind of positive relationship there. However, they are a little bit negative relationship as well. We think it might go at a few places, because both mechanisms might be at work, very similar to the face covering. When you see lower transmissibility rate and people feel a little bit more secure, kind of more encouraged to start to go out. So these are the changes in mobility in different categories that we have. Yeah, I only showed 2, but we actually tested all 6 of them for the different types of mobility. And this final 2 that I want to share with you are the variables in terms of vaccination rate and removed cases, percentage of removed cases. Both show overwhelmingly, or particularly this one, removed cases is all negative relationship, which makes perfect sense, right? If you have a high percentage of removed cases, means the person is might be infected and now cured. So it's kind of automatically, naturally vaccinated. So you have a higher rate of the removed cases, you can observe, you can see lower transmissibility rate. Makes perfect sense. We said it almost work the same way as vaccination, except that the vaccination might be what vaccination is a choice. You can see higher rate and people are more likely to go out there, right? So you see a little bit kind of anomalous and positive relationship there. And we have a hard time to explain it, but we think it might be very similar to the explanation of face covering or something. This is a matter of choice versus removed cases. It's not a matter of choice. Infected and get removed, right? It's not you don't choose to get infected and get removed, get cured. Okay. Finally, this is about the final slide about this model, specific model, exponential regression model. It's the overall R square. You can look at this distribution. It's very good model overall. The lowest is 67, I think, or 70. No, sorry, the lowest is 75. Oh, yeah, in the legend, from 75 all the way to 90, 92. The others, when you see the gray color, it means we don't have any data for at least one of the variables, so that we cannot do the model for that particular county. Okay, so that's exponential regression model. Finally, I only have one slide to show you regarding the random forest, which is the feature importance. So on the x-axis, these are the features: vaccination rate, removed cases, delta, human mobility, government policy. I don't know what the face covering is not here. I should have it. Probably it's not that significant, so it was out. The vertical line, the vertical y-axis shows the counties. So each county is actually a line, because there's so many. There are 3,000 counties, right? More than 3,000 counties. Not all of them have data. The real number that we were able to perform the analysis was, I think it's a little over 1,400, but still 1,400 is too much. So it's kind of thin line, the vertical line, over 1,400 lines below. But we still can see the general pattern. Removed cases and vaccination rate, those two are, and Delta variant, they are very significant features. And they are slight differences for different, this is very high for those particular counties. But overall, the general trend is very consistent across counties. All right, so that's the end of the second research question. And let me go quick so that we can have a little bit discussion time. And the final one is the time-specific GWR model. That means for fixed time, we look at just, for example, for all counties in the United States, all counties that do have data, we want to use geographically weighted regression to investigate the relationships between the effective reproduction number and the geographical context variables. So for this, of course, what time do we fix? We can do it for every single day, right? We just randomly choose to use June 1st, 2020, just for experiment. On that specific day, what does it look? What kind of relationship can we find? So that for that day, the specific day, this is the distribution of RE number, the effective reproduction number distribution here. And finally, when we run the GWR, this is the distribution of R squared. So that's the general result. And now we can do that with the GWR. We understand for each variable, we are able to map out the distribution. So here, this is about the relationship of local demographic and socioeconomic factors in terms of their contribution or their impact on the RE, the effective reproduction number. So here is the elderly population. This is interesting. Elderly population, green color means it's negative relationship. So overwhelmingly, for most places, it's negative relationship comparing to others. It's pretty interesting. It's negative. We think if you have, which means it's negative means if the county has a higher percentage of elderly population, the transmissibility could be lower. We think it makes sense because elderly population probably will be more cautious. They will observe more kind of the right things to do, will do all the right thing to protect themselves because they're vulnerable population and their family, friends will be more careful with that, right? And the other on the right side is the population density. It's negative relationship association, which means if we observe higher population density in that county, this is also interesting. Higher population density in a lot of places, you actually see lower transmissibility rates. Oh no, sorry, I'm wrong. That's only a few of them. That's only the green color, which is that relationship. But for all the other, the orange color is positive relationship. Okay, higher density, higher transmissibility, which kind of makes sense, right? Higher density means higher contact rate. Of course, higher transmissibility. This one is about the percentage of non-white population. I think this is probably particularly useful for people who are looking into health disparity issue. For non-white population, it's a positive relationship if you see a higher percentage of non-white population in that county comparing to other counties, you probably will see higher transmissibility rate. Yeah, the same with, this is something we actually spend a lot of time to think about the household income, overall household income and the relationship with the transmissibility is also positive. How could you explain it? But you actually can find those are different counties. For this one, you see very high number, high association. But in this one, the non-white population, it's not even significant. So we are talking about different counties. So in our discussion, not only among us, but also with other colleagues, and one explanation is probably higher income is a more economically active region area. So there is a higher chance of people going out and making interaction for that reason. So we don't know. That's a possibility. Yeah. So a few other things just to check out because it was raised in as a discussion topic, is a controversial topic. We just wanted to test it. The percentage of GOP votes here and the air pollution, air quality, the PM 2.5 index. So they are also, most of them, it's kind of bi-direction. You can see negative and positive, but overall it's generally positive relationship. So I will probably not go into that in too much detail. I will leave that for discussions if you are interested. I will stop right there and let me acknowledge, make the acknowledgement. The authors, we have 3 authors, me and Hao Yang, who is a doctoral student in our department. And we have Dr. Christopher Wallen, who is a professor in the College of Public Health at our university. And the dashboard that I showed you was developed by Xuebing Wei, who is an associate professor at James Madison University. Okay, I will, oh, I'm sorry. I wanted to have this discussion while opening up. Is there, maybe I will just quickly go through it, not reading it. But kind of go through, highlight something. We did develop a method to measure, to estimate the effective reproduction number. And using that space-time data set, we find out some pretty interesting, significant relationships between human behavior changes, policy factors on transmissibility. Geographically, we did also find out the relationship between some demographic and socioeconomic factors on the changing transmissibility. And this also varied geographically. The level of impact varied geographically. You can see some of them, you can see negative relationship in one area, but positive relationship in other areas. So that's kind of quite different. Okay, let me go quickly to, this is the last one. I just want to quickly point out I know I want to open up for further discussion, but I want to point out one, you probably will be asking why you do a temporal analysis and then spatial analysis, kind of vertical, horizontal, but not integrate. Why don't you do spatial temporal analysis together? Yeah, I totally agree with you. I think it will be really interesting just to look at them as a whole. But for our current research, we are particularly interested in kind of teasing out other influence. Just look at the temporal changes only and look at the spatial variation only, see to observe the kind of a baseline influence or relationship. And then currently we're trying to map out the possibility and analyze the spatial temporal relationships among those variables. So a lot of more work. We also acknowledge that we have no investigation on the quality of the source data. We did get the data from pretty, how do I say, reliable sources, respected data source from Harvard website, from Census Bureau, from Google Mobility Report. But again, the quality was, we did not investigate the quality of those data. So that might have some impact on our finding. All right, I will stop here and thank you. I love to hear your thoughts and comments. Stop sharing.
Thank Professor Yao gave a great presentation about these transmissibility of COVID-19 from the using different technologies. So also in terms of place-specific and the time-specific modelings. So currently we open to the questions. So to see if any questions. So So my first question is, it seems that you use compare different modeling techniques. So I saw it's very interesting to see actually for the random forest and also regression model, they actually have for the R square and accuracy is opposite. So it's opposite results for these two different models in terms of these different perspectives. So I'm wondering, like when in terms of like accuracy measurement, so then what specific actually accuracy measured for this random forest and regression model? Could you elaborate?
Oh, the accuracy. Yeah, we used root mean squared error. That's for the kind of like training data, testing data. Our testing data is the last month that we reserved. So it's kind of the root mean squared error for the accuracy assessment. That's one. And we also have R square for the model. It's not accuracy. That's not accuracy. It's
Yeah.
kind of, yeah, the quality of the model. But yeah, specifically for accuracy assessment, it's just the root mean squared error compared with the ground truth data.
Oh, okay. So which means for accuracy is using based on the training data.
No, testing data. We reserved 1 month of data. We did not use it at all. So that's the October 2021. We just saved it, not using it. So the constructed model were used to predict the October, 30 days in October. So the predicted numbers are compared against the reported cases.
Oh, okay. Okay, I see. So which means that there are certain data you are reserved for these.
Yes, as testing data. Yeah, yeah.
Okay.
Yeah, so 1 month data.
I see. So the other question is for the, I think you have several like factors in those maps showing like different factors how actually is affected is transmissibility. So it seems to have like some counties for the face covering, they have positive relationships. So how that can be
right. Yes. Yeah, I know. Those are the interesting thing. You can see both directions. Some are positive, others are negative, right? I think there are two mechanisms at work, possible two mechanisms. One is when they see the transmissibility rate is very high, people will start to wear face mask because it's very risky. So more people will, when it's high, people will start to do that. The other mechanism also at work, when people get this, a lot of people wear masks, the transmissibility may go down, right? The relationship can be at work in both ways.
Okay, I see. So which means that sometimes it's not causes, it's consequences in that case.
Right. It could be cause, because it does impact the infectiousness, which is the likelihood of getting infected. So when you wear it, it will help you. But the other, the response is also true. In response, when we see high or low, we respond in our own way. When it's low, we say, well, wearing mask is probably not necessary.
Okay.
So both way, both work as a response or as our kind of as the cause.
I see. So that's a mix.
Question.
Yeah. So the other thing is you're showing is one figure. Remember, is like different factors for the random forest. So it's like
it's a feature importance.
Huh?
Is that the map about feature importance of the random forest model? Not that one.
It's the figure shows like it seems one is a coefficient and one is different factors. So it's random forest for different factors like government policy, human mobility. That one.
It's not a map, right? It's just a figure.
Not a map.
Of
it's
the blue lines. Yeah, those are feature importance. Yeah, the darker the color, the higher the feature importance.
The what?
Feature importance. Feature
Yeah.
importance is an output of a random forest model. So they will tell you for each feature is a variable. For each of those variable, and the output of the random forest model will tell you what's the feature importance.
So then what's
The vertical one is the county.
what's that?
So each one, yeah, it's a county because there's a more than 1,400 counties in testing. We cannot list all of them. Yeah. So each thin line refers to a county.
Oh, okay. So each line is a county. So which means it doesn't matter actually what kind of
rank. Yeah, the order
okay.
doesn't matter. Yeah, right. Yeah, it's the overall pattern. If they are all dark colors, means this feature is important for most counties.
Oh, okay. I see. So for most so for each, so which means it seems then for that one it seems the policy the government policy is the least important, and the
I think it's a removed cases vaccination.
yeah, vaccination
is more important. Yeah, which makes sense. What do you think? Vaccine? Well, since the coming and onset of having vaccines, we started to kind of see big changes. Right? Government policy basically means what they will require, whether or not they will require mask wearing and so on and so forth. It's very, very helpful, probably, but not as effective as vaccine.
I see. Then how actually it's reflector. So for this actually is also reflect the temperature change or not, because actually it seems for the previous these COVID cases actually is more serious, but it's not that
transmissibility is not very high.
Yeah, then currently variant like Delta variant, these different variant cases is more like transmissibility.
Right. Yes.
So which means how actually. So which means for that figure also shows Delta.
Yeah, it does show Delta is a very important factor, whether or not it's a Delta. Well, because our data doesn't include Omicron. Omicron started early this year. Our data stopped at 2022. So I think the major thing for us is just the previous variant and Delta variant. That's what we tested. But the general picture, the modeling approach applies to all kinds of variants.
Okay.
This is the percentage of the variant for the specific type.
Okay, so which means you see so you see like these methods where if you use like Omicron will have the similar.
Yes, yeah, it can be used. Whether or not it's insignificant, we do not, but the method itself can be used for Omicron as well, for all kinds of variants.
Okay, and did you
try to collect data?
Yeah.
No, we haven't, because the major, it will be interesting too. We just didn't have time because the motivation was develop the method to do things, and the method is already there. If someone is interested and they can do it, I will probably ask our students whether or not, because they are going other ways to expand more possibility visualization. But you made a very good point. It might be interesting to continue on the Omicron variant.
Oh, okay, I see. And also, it will be the same. It seems your model actually is based on the variability. So, and it is based on the transmissibility, and also based on the so which means as long as know this variant transmissibility, then we'll predict what kind of
yeah, that's what we think. Yeah, because we did predict October cases and compared with the real October transmissibility. That's our evaluation. Yeah, it shows prediction is possible, but of course, I don't know whether or not they are willing to adopt this. Without it, yeah, it can be used for prediction.
Okay. And the other question is that I saw that the foreign, but when people compare like a foreign, the random forest and regression model, is random forest actually is
It's the best.
huh?
Yeah, it's the best, right? No.
It seems that they mentioned that the limitation of foreign, the random forest is to actually hard to compare different coefficient, but how actually you compare different coefficient based on that?
Yeah, I totally agree. That's exactly why I said, well, for the modeling results, random forest is good, but I'm still saying the best in terms of performance of the balance. Exponential is the best because the accuracy is not as good as random forest. However, it has very good interpretability. We can interpret it. We can map out the coefficients. You look at all the maps I showed. That's from exponential model, not from the random forest, because random forest doesn't have it. Yeah, so I totally, that's exactly why I totally agree with that kind of discussion.
I see. I see. That makes sense. Thank you so much. Thank you so much to give us such an excellent talk. So usually we give applause to the speakers at the end. Thank you so much.
Yeah, my pleasure. Thank you.
Yeah.
Right.